As we continue with our discussion on the diversity of women, we know that educating each population or each different demographic will help them in creating a cyclical effect of health in their communities. There are many similarities between the Black and Hispanic populations. We have higher mortality rates, and there are larger issues when it comes to stroke and diabetes. And some of that can be linked to education levels or access to education, the type of education that you receive. And so this is why education plays a huge role in our overall health. Let's move on and talk about the diversity of motherhood. One of the other professors sent me a link the other day, and it noted that the United States is the highest ranking country when it comes to infant or motherhood deaths during delivery. And that's kind of shocking because of the type of healthcare we have and because of the education levels of the doctors and nurses. It's very alarming to see that was one of the statistics. But when we talk about motherhood diversity, we can also look at how women have been changing in the workforce and with their marriages and their family. They're not getting married as often. They are developing careers. Some people are choosing to stay single. Some are choosing to not have any children. And that is a gigantic difference from just even the 1950s and 60s, which are our mothers and our grandmothers. So diversity of women has really changed during that time. And we also, because the age of marriage and having children has increased, there has also been an increase in the demand for fertility drugs and for fertility treatments, and stay-at-home parents are getting older. Teenage mothers is another issue because they're trying to balance their own needs with raising a child. And we know that as a teenager, sometimes you are really still a child yourself because you haven't had the life experiences that an older adult has, and that will lead itself to motherhood skills. And so it's very difficult for teenage mothers. Plus, they're still trying to continue their education. And of course, some women are that's not what they desire. They don't want to have any children. I know that I have 5 sisters and I'm the only one that has children. I have 1 daughter and none of the other 4 want children. So it's just a large change from what we have been seen. Then there are huge misconceptions when it comes to bisexual or homosexual, lesbian individuals, because they don't think they need as much health care when it comes to STI testing as if we were in a heterosexual relationship. And that's just not true. Women carry STDs and pass them along just like men do. And it doesn't matter what your sexual orientation, you should have consistent care through the use of a physician or clinic. That way you know you are healthy and you don't have to assume it. So I'm not going to go over some of these barriers to health, but you can look and see that some healthcare providers even discriminate against those who are same sex. And even though they're not legally allowed to, that doesn't mean that they may not offer you the same standard of care as they would someone else. So it's very important to be able to research your doctor's education. Once again, becomes a vital role so that you can have a healthy relationship, have a healthy body, regardless of the type of relationship that you are in. There are other types of diversity, such as incarcerated women. There are some women who are pregnant when they go into prison and actually give birth in the prison setting. And the healthcare can change depending on who's there, if they have any issues with treating individuals who are incarcerated, whether or not they're going to give them the same amount of control over their bodies or the same amount of knowledge, whether or not they're going to give them the same amount of medication that they would give someone else. So there are many issues when it comes to incarcerated women. And then, of course, women with disabilities. I've heard several people say they don't think women who have disabilities should have children. And so when we hear these types of things, it really does impact our knowledge and our own personal viewpoints towards things. Women with disabilities, there's not as much research. And as a result of that, there's not as much information for them. And so if you happen to suffer from a disability, then you also may have issues communicating, just like if you're not your first language has not been English. These are some of the same issues that women with disability face over the course of the United States and in the world. And then when we talk about global health issues, there are 10 leading risk factors that the World Health Organization has put out that account for more than 40% of all of the diseases worldwide. We're looking at 300,000 global deaths. 99% of those are in developing countries. Infectious diseases. These are the types of things that we get shots for, immunizations, before we go to school, before we're allowed to go into the public schools. They don't have access to these in some countries. And then, of course, which is very sad, chronic diseases are things that are long-standing diseases versus acute, something that just happens. We have so many chronic diseases in the United States for a country that's supposedly first world and developed. It's very, very sad that we're seeing death rates for some certain diseases just as high in the United States as they are in developing countries. So it's not just the United States, it's worldwide. This list is in no particular order of importance, but I do want to note that you see heart disease ranks number 1 regardless of where we are. Just worldwide, it is the biggest issue. And then we also see that diabetes is on the list. That's a huge issue. But cancer in the United States for women, female-related cancers, breast cancer, uterine cancer, cervical cancer, and others, that's not the case in other countries. So think about how the healthcare of women has put the United States in one of the leading countries with number 2 as cancer as a number 2 related top leading cause of death. And in other parts of the world, it's not. Be very mindful of these types of things. And then we look at stages of promotion of health in your life: adolescence, young adulthood, midlife crisis, and our senior citizen years. There's so much that we can learn from these different stages. It's beneficial not only to ourselves, but also when we are trying to promote health within our own children or our own community. It helps with respect and care for senior citizens. So adolescence, that's when you're small, you think you know everything, but you know this much. And puberty is just starting roundabout up to the age 17 or 18. You start noticing differences with men and women's bodies, peer pressure, you're trying to find yourself, you may experiment with things, you may have some risky behavior. This is all during the adolescence phase. And while it seems that it could be all fun and games at times, some of the mistakes you make in adolescence can affect you into your adult life, particularly when it comes to STDs where there is no cure. Continuing on, these are the top causes of death for female adolescents. Notice that suicide is on this list, which I think is terribly sad, particularly for women, because we face issues with body image, we face peer pressure when it comes to the way we look, with our hair, with our clothing. So suicide is one of the top leading causes for young adults and young people. And I just think that is horribly sad. And then, of course, there's homicide. And much of the homicide is from someone that you know, someone who's very close to the family. As we get into young adulthood, 18 to 44, see, so all of those who are in their 40th decade of life, be encouraged. You are still considered a young adult. With this age group, you start to develop more of your own independence, your own viewpoints. You respect yourself more than maybe somebody else will or has in the past. You still are engaged sometimes in risky behaviors. And I don't agree that violence and death or date rate should be included as a risky behavior, or at least not something that is your fault. So that may have been miscategorized, but the other activities you can control: your sexual activity, your nutrition, your exercising. But the violence is also something that we cannot necessarily control. So I think it should have been recategorized, and I want to be clear that this is not the order that I have put them in. I think it should be in its own category for violence against women. And then we look at the causes of death for women. As we can see, suicide and homicide are still on the list. Accidents, yes, but suicide and homicide, it seems like it carries itself between age groups. So let's look at the midlife crisis. We don't see suicide anymore, but we are still seeing heart disease. We're seeing heart disease and cancer and stroke, things that you may not have seen in your young adult life or your adolescence, because you just can do a lot more in adolescence. You can eat 25 slices of pizza and nothing will happen to you until we get up into our midlife crisis. So pardon me, I did say that heart disease wasn't on there, but it is at all stages. So at your midlife crisis level up until the age of 64, Then we see things such as job advancement and you establishing yourself, you becoming more settled and stable, having kids, etc., etc. You may be going through menopause, and it's more of a slowly you're coming to the top of the hill, but downhill is where it goes from there kind of situation. So these are the 5 types of top leading causes of death for women in midlife. Cancer, heart disease, stroke, chronic obstructive pulmonary diseases. Also, we can refer to them as upper and lower respiratory issues. And then we have diabetes. Diabetes and heart disease and stroke are very, very important because you can prevent much of those. And we're talking about type 2 diabetes, which is more lifestyle related. Stroke is often linked to heart disease because you have blockages going to the heart or to the brain. And so these are behaviors or illnesses that are based on the behaviors that you choose to engage in your life. So it's very important to make good decisions. And then, of course, at the age of 65, you're considered a senior. You get a discount at Denny's and pretty much everywhere else, and you are living in your golden years. So the life expectancy for women has actually increased, which is great. Women are going to outlive their male spouses or their male counterparts at this point. There may be retirement issues. You may lose your spouse. Sometimes depression happens. And then, of course, we have our chronic diseases, which continue to include basically heart disease, cancer, stroke, and diabetes. And then, of course, respiratory issues are added in. And remember that you might see these large issues, these large categories popping up because when you're 20, you can do a lot of things that you can't do when you're 65, but the body keeps score. The body keeps track, and it's taking a check mark of everything that you have ever done wrong, and eventually it will catch up with you, and this is kind of the time that that's going to happen. And so let me go back up to that slide for a second there. I want you guys to really focus on these 3 age categories, and it's not cooperating too much with me right now, but focus on the categories between the ages of 65 and up, 18 to 44, and also 45 to 64. These are going to give you a very good view into how women have changed over the course of their adolescence and their midlife, and the types of diseases that are basically carried with them their entire life that people continue to suffer with. But I do want you guys to be very, very well versed on those 3 categories. Ensure that you know what the top causes of death are for them, and also ensure that you can kind of differentiate when someone provides you with an example of what might happen later in life. You should be able to differentiate between those stages. You should be able to give examples of behaviors that will be beneficial in preventing these types of diseases. And these are so common. It's very sad in the United States. They're so common. But if you know the behaviors that will prevent or at least give you a large boost in preventing these types of diseases, then it is your responsibility to do so. So remember, back to that old adage, an apple a day keeps the doctor away. Think about that when you put food in your body, women. We have smaller lungs. We have lower bone density. And so we can't always get away with the things that men do. Men can have 2 drinks and still be within the legal limits to drive, and women can have 1. Otherwise, we're considered above the legal limit. So we can't do as much with our body because our frames are smaller. Our muscle mass is lower. We're not inferior. We're just a little bit smaller. And so as a result of that, we can see effects more often or in larger degree than a man can when he does the exact same thing. So ladies, take care of yourselves, and I hope you all are enjoying the course, and be prepared for the test. So when it comes up, it will be, I believe, over chapters 1 through 5. Have a wonderful, wonderful rest of your day. Bye-bye now.